fired up. I'm excited. Wow, Tommy D, this is supposed to be a serious show about hashtag ending the stigma. It is a serious show, gang, but I believe we can normalize it by having some fun, by listening to some tunes, by listening to some music. And every week on the show, I tell you this, I don't have the answers, but I have relationships and I have connections to people who can tell us about the stigma through their lens. Tell us about mental health. Tell us about mental illness. And we're going to have these discussions until we stop. I'll tell you when I'll stop having these discussions, when we've ended the stigma. All right? So you're stuck with me until then. The show is called hashtag ending the stigma. My guest is Dr. Chris Fischer from Zucker Hillside Hospital. Chris, thanks for being here. This is about you telling me your story about what you do, why you do it, and how you see ways we can end the stigma. How's that sound?
Sounds good.
Good.
Thank you so much for having me. Excited to be here.
Absolutely.
So I guess by ways of background.
Please, yeah.
I'm a licensed clinical psychologist by trade. I currently am a director of behavioral health over at Zucker Hillside Hospital. So I oversee the adult outpatient psychiatry department, which is made up of a few different clinics. So we've got our general adult clinic, we've got our behavioral health crisis center, which is kind of like our urgy behavioral health center.
Okay.
And then we recently launched a rapid access clinic, which is a short-term treatment program that kind of bridges between emergency medicine and long-term care.
Okay.
And then I oversee a clozapine clinic, which is a specialized medication clinic for people with psychosis that have had, have been non-responders to several types of medications.
Okay. So we found out just earlier that we went to the same high school together, although, I mean, people probably think we're the same age. I'm a few years older than you are.
Aged well.
Yeah, very interesting. Well, shout out to Chaminade High School, right? That's where we both went to school at different times. When you're in high school, and then we talked a little bit about where you went to college and things like that, I always ask people these conversations when I meet them, like, what is the why, or what is the catalyst that put you in this direction towards behavioral health and wanting to work with the population in this regard? Like, what happened there for you?
Yeah, I guess from probably around high school age, going to Chaminade, I was very aware of the privilege of, the student body there, the privilege of being able to receive an education there, and kind of what that meant for you moving forward, right? And I think that being a part of that group, I also started to recognize that there were similarities between me and others, but also differences. Okay. Right? And I think from there, I didn't know exactly what I wanted to go into, but I always knew I enjoyed being around people. Okay. Right? I played sports. I was an athlete there. Yes, the goal was to train hard and win. Yeah. But the memories that I took away were really the ones where, we're on the bus going to games, locker room time, just kind of, hanging out with the guys, getting to know the guys on a deeper level. That was always what was most fulfilling for me. So then moving forward, kind of going into college, declaring a major, thinking about what I want to do career-wise, I started out as an accounting major. You did? Okay. Thinking, business is the route to take. And I remember sitting in my first accounting class and I was like, I just don't think this is it. I just don't think this is it. There was a gut feeling that I learned to trust, as I was getting older. And I remember going to my older brother, who was a junior at the time, same college, living together. And I asked him, I told him, I'm not feeling so great about this decision. I know it's early, I should probably play it out. And he asked me, so what are you interested in? Have you been through any other classes, any curriculum that you found, of interest? And I said, I'm in psychology. My psychology class was just so interesting, kind of thinking about the inner workings of others, why, how, when, all these influencers that make people who they are and different from other people. So he said, why don't you just pursue that? Sure. What was he studying at the time? He's a psychiatrist now. Oh, wow. Actually, so he was studying, I think he majored in biology. Okay. So he was going the medical school route. Sure. I was never that interested in the hard sciences, but when we got to the social sciences, I really felt like there was a place for me there. There was flexibility there, and my innate kind of characteristics and trait just fit well. Yeah. What characteristics? Tell me about that. So I'm a natural. I would say I'm naturally curious about people, about circumstances, about situations, kind of always diving deeper into, what might be the function of that? Why did that happen that way? Why didn't it happen this other way? Kind of looking back, reflecting, processing, just kind of has been a natural part of my process. So I found where that would be a great fit, and it was in the field of psychology.
I love that. That's incredible. And, I think a lot in terms of ripple effect and conversations. What if you didn't go to your brother and have that conversation? And what if you just said, let me stick with accounting, right? I was a finance major, right?
Okay.
And I thought one day I would be a stockbroker because I grew up in an era where like, oh, you go do this and that's how you make a lot of money. And then I realized what I still remember from finance is opportunity cost. And that's the term. And I don't use it to say if I had $10,000 and I invested here, there's all these other opportunities.
Right.
I think of it in time, the opportunity cost of my time, and that's like something that stays with me. So, but I don't do any of that in my profession. Like meaning I'm not in finance. I own an insurance agency, so I guess kind of quasi connected a little bit, but not into what I thought I'd be doing. Good on you as a younger man to realize like here's something that I'm keying into and to lean into that. So in your everyday, what does it look like as you run this part of the organization there, right? And you have these it almost in my mind like sort of like silos of what you do. What is a day in the life, Chris? What does that look like?
Yeah. So a lot of shifting and transitioning, I would say. I am a psychologist by practice, by trade,
right.
But I wear a lot of other hats, hold a lot of other identities. So I wake up, I'm a father, I'm a husband.
Love that. Yeah.
So waking up early, trying to make sure that my kids are getting ready, that my wife's the boss. So I'm kind of her sidekick, her assistant, whatever she needs me to help with, I try to do.
Sure.
Once they're off and settled, I take my route up to the hospital. I'm coming in, saying good morning to my staff, looking at my calendar, right? Thinking, what's needed of me today. For my position now, I don't deliver direct patient care.
You did though at one point.
I did.
At Zucker or?
At Zucker and at other hospital systems prior. I was an inpatient psychologist, so working with people that were deemed, unsafe.
Let me stop a second, just to give people context too. Inpatient versus outpatient, things like that. Just explain some of that for us.
Yeah, so inpatient care is when, especially in psychiatry or behavioral health, is when someone either involuntarily or voluntarily comes to stay in the hospital to receive 24-hour around-the-clock care.
Got it.
The criteria, often involuntarily, is that they are deemed a danger to themselves or other. Voluntarily, people will come in and say that, I believe I'm at risk of potentially hurting myself, hurting someone else. Right now, I'm dealing with a number of stressors that feel overwhelming for me. I think I just need a few days away to kind of get my feet back up under me, regroup, and then figure out how best to go back out and face my challenges. So that's inpatient care. Outpatient care, which I oversee now, is people are reintegrated back into the community.
Got it. So they'll come to the health system for different services?
They'll come to the health system, for their scheduled appointments. Like I said, we have the crisis center, which is kind of the walk-in urgent care as needed. But once people are connected, they're coming in for their, med management, psychiatry visits, individual therapy, group therapy visits. So yeah, those are kind of the differences.
Got it. So you work patient-facing, right? Direct care, I guess, right? And now you're no longer that. You've elevated to administrative leadership, that sort of thing.
Yeah, and I guess where the aspirations came from for that was, I felt like I was trained and becoming more and more competent at helping the person in front of me and helping the family, that the family system that patient, kind of resides within, and then thinking more and more about impact and scale. Right now in my position, I impact the service that's delivered to the patients, to the family.
Right, so in essence, you're able to impact or touch more people, not directly, but through leadership.
Indirectly, yeah. And my influence as a clinical lead, as a supervisor, as an administrator, I feel like, yes, touching more people, touching systems, touching narratives, touching policy at times. So thinking about, how I can stretch myself and scale myself in a way that I couldn't do, one-to-one.
Well, let's talk about narratives and policy. Let's talk about what you mean by that. Because I mean, when I say hashtag ending the stigma together, I'm talking about a narrative right there. And I goofed around a little bit with you today because we hadn't gotten to meet each other, but I said, this show is not about making more stigma, that's for sure. It's about ending the stigma. So when you talk about narratives, how does that relate inside of a major health system or in your part of the health system?
Well, it's an ecosystem, right? So there's a culture, and there are certain narratives and rules and policies, sometimes written and unwritten, sometimes implicit or explicit, right? That kind of govern, this realm of healthcare. And for many, many years, there's been stigma around those diagnosed with psychiatric illnesses or mental conditions that are biased. That are not accurate, that are fear generated, that are, kind of societally instilled.
Do you ever, my challenge with this is trying to figure out why, where does that come from? Do you have, through your lens, I'm sure you have your own opinions on that, where some of that stigma comes from?
Yeah, I think it comes from a combination of places, right? I think it's social in that I think naturally we have, how could you say it? Almost like an instinct to want to group people, right? Like just make sense and organize people
That's
in a certain
human
way.
thing we
Yes.
do.
Yeah, a tendency, I guess, is the best way to do it, the best way to say it. And that just helps us make sense of the world more simply.
Sure. I guess if we could put people in batches,
Yeah,
okay.
Right, it informs our decision.
Sure.
If we took time to analyze to the depth of every decision.
For individual people.
Yes,
right.
we wouldn't move that far.
Right.
Throughout our days, we wouldn't find ourselves progressing through days very quickly.
Sure.
So we categorize people, and I think what happens is that then creates silos, right, and creates homogenous groups, right? People that are similar group together, people that are different then group away. And we tend to project, understanding of the other group that sometimes doesn't align because we haven't interacted. We've been sectioned off, right? And then that just sticks for a number of reasons too. Certain groups can develop more power than other groups. So stigma has a function of keeping powerful groups in power and keeping other groups more marginalized.
Yeah. Wow. I'm learning so much through doing this series. I joked a couple weeks ago, I wish I had my notebook with me.
Yeah.
But the benefit is I'm doing the show and I can go back and watch my own show.
You can always rewind.
I can always rewind. So, wow, really, really good stuff. When you talk about policy, you talk about policy internally for the organization, right? You're not saying so much like going up to Albany or down to DC from a policy perspective.
I haven't gotten there yet.
Yeah, I like that. Little ambition.
There is that part of me. So my dad, by background, he passed away in 2016. He was a Long Island politician.
Oh, is that right?
So he was the first African-American councilman of the town of Hempstead.
No kidding. Okay.
And was ultimately the deputy town executive of Nassau County.
I didn't know that. Okay.
So he was an administrator and educator,
So there's some of that.
And as a psychologist, you function in a lot of different ways too. I'm a provider, but I'm also an educator. I'm an advocate. I'm a resource for people, a consultant. So thinking about scalability and right now in terms of policy, it's more so on the departmental level, right? Like how are we making policy with the patient and their family in mind, not just the system in mind?
Got it. So from a service deliverable perspective, how is this going to impact the people we serve? Not just how is this good for, in this case, the health system or the department of the health system, right? Yeah. Little customer service, maybe.
Exactly. And I think it's, you talked about those pillars, those buckets, right? It's patient experience, family experience, employee engagement, satisfaction, also, kind of meeting the mission and the vision of the system. Right? Like how do I make sure that everything that I'm doing is working toward one of these three buckets, right? Just the three that I gave as an example, to make sure that what I'm doing is not wasteful, right? And I know that I'm targeting all of the groups that I need to in the work that I'm doing.
I love that. So many stakeholders for sure, but at the end of the day, Northwell being a large business, it is a nonprofit organization, right? That has, I think we were talking in the hallway here, 80,000 employees. 80 plus thousand. So here's a question I didn't really intend on asking you, but because of where we're going, I think it makes sense to touch upon. How many folks report to you? Do you have a number like that?
So I have a number of direct reports, but there are tiered off.
Okay.
So I have approximately, I think, 14 or 15 direct reports.
Okay, and then there's folks that tree down from them.
So dotted lines to me.
Got it.
So ultimately, I think I'm responsible now for over 100 plus employees.
Perfect. So here's a question that I want to go to. As a leader in an organization like yours, in delivering service that we're talking about to patients and people that come through the system, that's one of your stakeholders where you would be concerned, I would say, about their experience and their mental health, right? So then I say to you, you have these 100 dotted line and/or direct reports come through to you who are dealing with this population with serious mental illness. How do you check in on these people, your people?
Yeah.
How do you make sure that there's that opportunity to have those conversations?
No. It's both on the individual and group level, right? So making sure that there are spaces that, we come together and we check in on how we're doing, and asking them, because I think a lot of times where the system is at fault is assuming what their employees or their stakeholders need, rather than asking them. Right, like how can I best support you in what you're doing? How can we work as partners? Right, it's not trying to really level the power hierarchy.
I like that.
That we're all individuals, we're all dealing with patients in different capacities. How can I be a resource for you? And one of the other things that I've done in my department is I have an open door policy. Right, like literally, so there's actually a door that opens to kind of a division director suite. We keep that open. We keep our doors open. People are inclined to come, knock, pop in. Hey, do you have a few minutes? Jump on Teams. It's really being accessible. Not only speaking it, but following through with it.
But that's like this thing, like we're in the work, right? We're doing the work, and I spend my time, I told you earlier, with so many nonprofit organizations, and it's one thing to say, well, we do the work for the people we serve, but then we got to forget about, or then we sometimes forget about the people who are on our team who are doing the service.
Right.
And I have a couple weeks ago, Jeff McQueen was here. I don't know if you remember. We'll make sure you do. He's the executive director of the Mental Health Association in Nassau County. Okay. My friend Yolanda Rabano Gross was here from Options for Community Living. She's the CEO there, and I ask them all these questions, like because their people, your people that are that are serving the population, are more affected because they're working and serving these people who are having these challenges. Right. So none of us can be Superman, and it's like, oh, I didn't feel any of that. That you just that interaction is now changing me, and some of that could be traumatic, right? And so there's that even more so that need, and to hear that open door policy and those check-ins, I think is critically important.
And I think it's getting to know the individual as a person.
Yes.
Right, not just as support staff, right? I know the people in my department whose kids play football on the weekends, those who like to go to concerts, just checking in, like when's the next time you're going away? I see you haven't submitted PTO in a while, what are you planning?
Look at that.
So like really making sure that I am attending to each individual, their subgroup that fills then the larger group.
I love that. Nice call out on the PTO thing, because I've been a sales guy my whole life, and we was never looked kindly upon when we took time off and things like that. And I found as I've gotten older, it's more important. I used to, even within the last couple of years, COVID included, it'll be like, no, I'm never off, man. No, I'm never off, man. You need me, you get me on my cell. I'm never off. It's not appropriate. We need that time with family, even alone. And I was talking to a buddy of mine, we had coffee yesterday, I was just saying, I don't know about you, dude, but I love being alone. I love people. I do. I love being with people in community. I also like being without people. There's that. And we need to find that. And from a leadership perspective, I love what you're saying about, I notice you haven't taken any PTO. Like let's make that happen.
No, it makes a lot of sense. Like, we're dynamic, right? There are times, I think sometimes we like to keep ourselves categorized, right? And over-identify with being an extrovert or having that be such a representation of our personality. And people can be both. They exist on a spectrum. There are times where we need people more. There are times where we want or need people less. And it's okay as long as you're, kind of aware of where you are on that spectrum. And for me, that's really what it's about, is, making sure that people take time, because you have to recharge. If we want you to perform and be the best you need to be able to rejuvenate, recharge, 100%. Relax, regroup. And so, but making sure that, the operation still runs. Right. So we've got coverage systems in place. And I always tell people, a 3-day weekend's coming up now.
Yeah.
I do not want to come in on Tuesday and see that people were sending emails on Monday and the weekend and Monday.
Yeah.
We have to trust the systems that we have in place. We have systems, backup systems, coverage systems that will keep our patients and their families safe.
Yeah.
But you have to take your time too.
Yeah, critically important to bring out, because again, in this culture, in this country, I think it's so interesting when you go to Europe. I've never been to Europe, like I have, but not like in the summer. Like Europe, they take off like 8 weeks.
Oh yeah.
Like
the paternity leave in Europe is longer than our maternity leave here.
We wouldn't, like in this country, you can't even, you got to tell people to take the 3-day weekend without checking email, right?
Right.
And a lot of that comes from leadership, but I think it also, meaning like, no, that's not what we do here. Don't check your email, but also as a leader, I'm not going to email you at 10 o'clock tonight.
Right.
And because you're not supposed to be getting that email at 10 o'clock tonight. It's expectations and things like that. But I just find our society is so, the American society, U.S., like we just go and we go and we go and we go, and that's become cultural. And it's, I personally, I'll just speak about it from my own life, is why I would always tell people, I'm always on. Don't worry about it, I'm always on. Because I felt like it was like shameful to say I'm off.
Right.
That's my own stuff I'll deal with, right? But that comes from like, I'd like to take, I said last summer, I'm taking the whole month of August off. Like, not going to be like disappear, but like I'm just not going to have meetings.
Right.
Like I can do that. I own my own business, right? I wanted to do that. Did so. But but you can pull that off in other parts of the world, and it's appropriate.
Yeah.
Yeah.
And I think we evolve, right? Generation to generation, we learn, we look back, and we try to improve, right? And I think what we never looked at in prior, or as closely in prior generations, was the cost.
Yeah.
Right? Always the benefit of being on, the opportunity, never anything missed. But then what toll was that taking on us?
Sure.
And I think in some of the reduction, stigma reduction efforts, we're recognizing, that we are vulnerable to stress. We are susceptible to the impact, the effects of running ourselves down and overcommitting in that way. And I think that we are creating outlets now that our parents, might judge in a certain way, but would have really appreciated back then.
Well, I think even especially younger than you or I, it's that this next generation. Although I mean, you're behind me in age, so it may be even you experience it more with your peers.
Yeah.
But just like these young folks are like, what's my mental health services? I'm going to come work here. What do I get for mental health? What's PTO look like? Do you have an EAP? Like and they want it to know this, and that to me is great. What a sea change that is, to just say like that's where we're going. Right. And that, I think those folks, these younger people are going, they are already at this point ending the stigma. That's like, this is conversational, right? So it's folks of our eras and the more advanced years that have to keep having this dialogue. Yeah,
and I think it's only going to improve.
I think so.
Right? I think a new standard's been set. The bar has been adjusted, and like you talked about, the younger generation, they're coming into therapy with more self-awareness, with more motivation, with more insight. I work with some teenagers now, and they come in and they say, have you been listening to that podcast or that blog? Have you read this book on that?
And it's about mental health?
It's about mental health. It's about mindset. It's about, kind of growth focus, coping mechanisms, kind of understanding mental health in the system. And I'm just like, wow.
These are young people.
Young people.
Yeah.
I was like, I need to join their book club.
Yeah, no kidding.
To keep myself up to speed before I get surpassed.
For sure.
As a professional in this field.
No kidding.
They're just coming in more primed and more ready to do the more difficult work.
That's incredible. That's great. And that's like what this project for me, or this campaign, is all about. Because as you mentioned, these young people, maybe there's a panel discussion that we have where because I think Whitney Houston said, I believe the children are our future. Who knew I would sing right here?
Right. Look at that.
That's what this show is all about. Thank you, bro. Appreciate you. Well, let me ask you this. Through your lens, through your experience, the work you've done, and we talk about young people and things like that, how do you see ways we can end this stigma?
Yeah. It's a big question.
I know.
Right, big question. But I think it starts by, looking internally, right? Like finding your why, exploring and examining and being curious about your own stigmas, right? Your own automatic thoughts, right? That's usually the pathway to our belief system, right? Like what comes up for me cognitively without any effort, right? And where does that stem from?
Wow.
right? And then as you do that your own work, finding spaces with people that are different from you and being curious about them.
And why they feel a certain way.
And why they feel a certain way and their experience. Because, you know, this is in the literature, right? That these groups were more similar than we are different.
Of course.
But what we fixate on and what gets spotlighted are the differences.
Yeah.
And then we tend to, you know, kind of attribute or project whatever our belief system is onto them. So especially in my role, is trying to foster and facilitate spaces where people can come together and learn from each other.
Talk to me about that. How do you do that? How do you make these spaces?
Yeah. No, so I really think about, okay, so, you know, time is our most valuable resource, right? Not only as an employee, but in life.
Yeah.
And thinking about where can this live? Where can it exist and how? Right? Like I throw the idea out to my team. It's like, yo, you know, guys, why don't we create a case conference meeting?
Okay.
You know, just bringing people in of different mindsets, different frameworks to discuss cases. Not
cases meaning individual.
Individual. You know, I'm just relating it to my career. But you know, what's a social work perspective on what's going on? What's a psychology perspective? How does psychiatry? How does support staff that doesn't have, you know, mental health training, necessarily formal mental health training, what do they think about it? You know, what are your insights?
Because that informs you, right? Because I could see, we learn how they see the world. Like that's why I use that word lens a lot. And right? So that's, because then you go, oh, right, wow. That's like an epiphany. Like I didn't see it that way, that sort of stuff.
Right, and just opening our horizons to understand, like, how is it that you see it and why is it that you see it that way? Because it's not just that, you know, our way or the highway, right? The way I see it is the way it is. But sometimes what happens is when that other information comes in, it can directly challenge our beliefs, and that doesn't feel good. So people will typically double down on theirs, right? But if you're not aware of that, you don't recognize the missed opportunity that just transpired.
I gotta say this one thing. There's this meme where it's like two different individuals are sitting this way, and there's a number in between, right? And well, from my perspective, it's a 6, and your perspective, it's a 9. Right.
And we're looking at the same.
We're looking at the same thing, right? But I'm seeing it from a different perspective, from a different lens. And if you can see it my way, and I can see it your way, or we can, like, we move together and we're looking at it together. Oh, now I can understand perspective. And isn't that how we all grow? That's the whole thing.
And that's a process of joining, right? And we feel more safe, more secure, more powerful when we're together versus separate. And I think that is the ultimate goal.
100%.
You know, you start on a small scale and you work your way up, and you hope that each level above, you know, the group that's bringing that perspective, you know, can open the eyes, can open the ears of those in more powerful positions to then support the change that needs to come.
Support the change. I mean, you all should join us on this mission of education and learning, because I feel change just getting to know you for 30 minutes we spent together, Chris. Thank you for being part of this. Thank you for helping me change the world, because I think the more we do and the more we have these conversations, the more we get to understand each other, and that's how we end the stigma. That's really what I believe.
Together.
Yes, you got it. I love it. Thanks for being here, man.
Of course.
Thank you so much.
I
appreciate it. Dr. Chris Fischer, Zucker Hillside Hospital, thanks for being here. This is another episode, gang. We're doing this, man. We're on the journey, ending the stigma together. I tell you this, and I'm going to tell you every week, I don't have the answers, but I have the relationships and connections. I know this resonates with many of you, this conversation, so if it does and you want to plug in with me, there's going to be some information at the end. If you want to suggest somebody that should be on this show, suggest somebody that we should connect with, please do. I look forward to connecting with you all. Thanks again for checking in. Make it a great day, or just make it a great day. This has been another In Focus production. I'll see you guys later. Bye now.